Hi, it's Tamika Chambers here with another question for you. As always, I encourage you to have something to write with, something to write on, and not only note your answer, but think about what your rationale is. Why did you choose that answer? Because you want to see if your rationale is in alignment with the question's rationale, right? So you are caring for a patient with a recurrent glioblastoma who is receiving dexamethasone, Decadron 4 milligrams IV every 6 hours to relieve symptoms of right arm weakness and headache. Which assessment information concerns you the most? So what do you want to know? You want to know definitely their diagnosis. Do we have an age? No. Medications they're receiving? Yes, we have that. And symptoms. We do have that too as well. Right arm weakness and headache. And then also we're looking at which assessment concerns you the most. So go down the line. There's no tricks. Just go straight down the line. You're working the question first. So we have someone with a recurrent glioblastoma receiving dexamethasone and having symptoms of right arm weakness and headache. What concerns me the most regarding this? Is it the patient does not recognize family members, the blood glucose level is 234 milligrams per deciliter, or the patient complains of continued headache, or the daily weight has increased by 1 kilogram? All right, go ahead and note your answer. All right, so this is going to give you a clue. As always, I tell you to get those keywords, those clues that can help lead you to the treasure. And remember, your answer has to fit those pieces, other pieces of the puzzle. So your keywords are your puzzles. Your keywords are the pieces of the puzzle, and your answer is going to be that missing piece, if you will. All right, so you have to know glioblastoma. What is that dealing with? That's dealing with the brains, nerve cells of the brain. So they're receiving dexamethasone, which is a steroid, and we want to know which one concerns us the most. So we know steroids, SONs, are going to raise the blood sugar. 234 is not too bad, you guys. That is not the most thing that we should be worried about. The patient complains of a continued headache. Yeah, that's letting us know that they're going to have headaches. That's part of the symptom. The daily weight has increased by 1 kilogram. Not so much. We're going to look into all this stuff, but if that patient does not recognize family members, that's an issue, right? Because we're thinking there's something going on with that patient. They may have increased intracranial pressure, right? So we definitely want to communicate this to the doctor as soon as possible. So again, looking at the question, what are those key words, those pieces of the puzzle? And your next piece is going to fit really well with what's going on. Think about a puzzle, and that piece has to fit well in order to make it work, right? So boost your critical thinking skills. We're coming up to 2025. We got to do something different because you have work to do. I'll talk to you soon.